Okay, today we're going to do the growth and development of the toddler in preschool. We will begin with the toddler. You will find this information in your textbook under Chapter 9. Growth during the toddler years. That's ages 1 through 3. The weight. There's a rapid growth rate which starts to slow down. The weight is 4 times their birth weight by the age of 2.5. Height. At 2 years, their height is 50% of their future adult height. Their head circumference will measure 19.5 to 20 inches by the age of 2, and they will have achieved 90% of the size of their brain by age 2. The anterior fontanelle closes by 18 months. I believe your textbook says 18 to 19 months, so that's fine. Okay. At this age, they will develop gross motor skills. They're still a little clumsy. They can walk without any assistance. They can jump in place by 18 months. They can go up and down stairs and run fairly well by 24 months. Their fine motor development, they can use a cup by 15 months. They can build a tower with blocks by 15 months. And generally they can hold a crayon with their fingers by 24 months. Sensory development. They know their name by 12 months, and they can refer to themselves. They can follow simple instructions by age 2. They can also use short sentences by 18 months to 2 years. They remember and repeat numbers by the age of 3. And they're able to speak almost 300 words by the age of 2. So, at this age, you have to be very careful of what you say because they do repeat everything they hear. All right, let's look at cognitive development. There are milestones at this age. They can comprehend more words than they can actually speak at this time. So, comprehension is better than verbalization. They do have some moral development at this time. They have a little concept of what's right and wrong, but still at this age, they will tend to hit someone just to see how that person reacts because they find it exciting. So they do know a little bit about right and wrong, but they still think that hitting is kind of playful because they're looking for a reaction from someone. Okay, one word you want to remember as far as during the toddler age is object permanency. This is the knowledge that an object or person continues to exist even when it's not seen, heard, or felt. So object permanency, once again, is established in this age range, which is 1 to 3. And this is the knowledge that an object or person still exists when they're not seen, heard, or felt. This is where you can cover up a toy, and even though it is covered, they understand that the object is still there. They are very what do we call it? The word is they have realistic behaviors, meaning they like things very much the same. They maintain, as I said, sameness. They like to eat the same foods. They like the same routine. This provides them with a sense of security. And they are very much into negativism. They know that word no. This is when they learn the word no. As far as nutrition, their growth rate is going to slow by the age of 12 to 18 months. They may go through a period in which their appetite decreases And this is called a physiological anorexia. They become very picky, and as I said earlier, they like the same foods, and they like to eat around the same time. All right? You want to avoid large pieces of foods such as hot dogs, grapes, peanuts, and cherries, because at this age they can choke very easily. So you want to cut their food very small. They have 20 of what is known as their deciduous teeth. These are their first set of teeth that come in and that will come out. These are their baby teeth. They're called deciduous teeth. And they are all going to be present by age 2.5 to 3 years old. It is very important at this age that we teach them good dental practices, because even though their teeth will eventually fall out, if they do not take care of their teeth properly, it can cause gum disease, which will affect their permanent teeth when they come in. So teaching them to brush and to rinse is very important. All right, let's talk about play. The toddler, they begin to form an imagination here. So it begins to be very imaginative. They like to play make-believe. They like to imitate adults. At this time, they like to play dress-up. They also like to play with blocks, push toys, puzzles, and they're very much into singing songs, repetitive songs. Okay? So they like Old MacDonald's, songs like The Wheels on the Bus. Okay? They're also into what is known as parallel play. They will play alongside other children, but they don't necessarily play with the other child. Okay? So they'll have a truck and the other child will have a truck, and that is what is known as parallel play. You may have observed this with children of your own. At this age group, they don't necessarily play in groups. They play side by side. All right, let's look at safety. These are pictures of my grandbaby. All right, let's look at safety. Car seat safety still needs to be a priority here. The car seat does need to be installed properly. We do not need to change their car seat sitting forward until they are 40 pounds. And then you'll turn them facing forward, making sure that the seat is still properly attached. All right. We need to supervise their indoor and outdoor play, because at this age they also become very adventurous. But remember, their gross motor skills are very immature still, and so they will have the tendency to fall very easily. We want to teach them to prevent any injuries, not to climb on cabinets, not to climb up on top of stairways. So you want to use you want to childproof the house, and you want to put the ladders at the stairway so that they don't try to go down the stairs. You want to be sure that you securely lock any medicines in medicine cabinets, because at this age they think everything is candy. All right. You also want to make sure that they don't play with plastic bags or with plastic that comes off of dry cleaning, because that increases the risk for suffocation. They think it's toys, but they can get suffocated very easily. You also want to be very cautious about having old refrigerators or freezers in the storage areas, because they like to hide, and so they'll hide in these things and not be able to open the tops, and that can cause suffocation. So most areas ask you to either remove the doors or to get rid of unused refrigerators and freezers. Okay? You also want to be, once again, very cautious as far as any type of chemicals, because at this age, everything they see, they don't understand that it's harmful, and they may try to ingest it. So being aware of what the poison control numbers, having those posted is very important. So that if the child does ingest bleach or antifreeze, you can call this 1-800 number and they can tell you what is needed, what you need to do for the child. And that's poison control. All right. Let's look at a toddler's reaction to illness and hospitalization. When children are admitted to the hospital, this breaks their routine. Okay, so thus it causes them to have feelings of anxiety. They will have what is known as separation anxiety. They'll think that they are going to be separated from their parents. They are very fearful of the hospital. The stages of separation anxiety go in this route. First, the child is going to protest. They're going to become very agitated and angry. Then they're going to go through a period of where they feel a lot of despair, and they'll be withdrawn, and they'll appear to be very sad. And then later, the last stage is detachment. This is when the child appears happy. They become interested in the environment that they're in. They become attached to the staff. They'll talk to the staff. And this is their settling down and becoming comfortable with their hospitalization. Okay? So remember, one of the main important things to remember about the illness and hospitalization of infants and toddlers is that they are going to have some separation anxiety. Okay, and these are the stages of separation anxiety that I just discussed with you. Remember, protest, despair, and detachment. All right, here is a quick quote. Children are unpredictable. You never know what inconsistency is. They're going to catch you in next, because they remember everything and they take everything you say for the gospel. Okay? All right. Let's move on to the next stage for growth and development. And that is the preschooler. This is in your textbook under chapter 10. The preschooler. The preschooler is age 3 to 6. All right, that's preschooler ages 3 to 6. As far as physically, their weight growth is going to slow and become very steady. They usually gain between 4 to 6 pounds per year. Once again, their growth is going to be slow and steady, and they're going to usually gain between 4 to 6 pounds per year. Their height increases 3 inches a year. They're going to have increased hand and eye coordination, and they're going to also have improved muscle coordination and development of fine motor skills at this age. Okay, here you have a child standing on one leg. This is an accomplishment. This is showing that they are developing more or improved motor skills here. Okay. At this age, the child develops skills such as skipping, hopping on one foot, and this is generally done by age 4. They learn to ride a tricycle by age 3. They can throw and catch a ball well by age 5. All right. The preschooler knows about 2,000 words by age 5. And they have increased strength and improvement in their fine, gross motor skills at this time. Cognitively, they learn, they develop what is known as fear. Up till this point, they've had no fear at all. They've had some anxiety, but they really haven't have fearful feelings. So they develop fear, and they also, at this point, increase their vocabulary, which increases their language. As far as fear, the child may become very fearful of real or imagined fears. Okay? At this age, they may have a fear of the dark. They may have a fear when the lights are not on. So, to deal with this, the caregiver or parent needs to talk with the child about their fear, make them realize that some things are not real, and you may have to utilize a night light in the child's room. Okay? All right. As far as language, there's an increase in their vocabulary. They can actually string together sentences at this time. This is telegraphic speech, meaning they can do more than one sentence at a time. They can actually stream together 3 or 4 words, which increases their length of their sentences. Sorry about that. Nutrition. The preschoolers' nutrition is very similar to that of the toddlers. They have preferences. They have many likes and dislikes at this point. And this is going to be influenced by others. They may note that other children don't eat the edges of their bread, and so they'll develop a dislike for eating the edges of their bread. However, in the past, they've always done that. Or they may develop where they won't eat the peels on apples, and years ago, they ate the apple with the peel. Okay? So they're going to start to demonstrate food preferences for likes and dislikes, and these are going to be influenced by other children. We want to once again reinforce good, healthy dental hygiene. All right. And children in this age also go through a period where they will only eat food or foods that may appear only in one color. You know, they only want foods that are yellow, or they only want foods that are orange. That does occur in the preschool age also. Okay? Let's look at play. This is a food pyramid, and it tells you the number of items for your child to be eaten healthy. You can actually go online and pull that up, and it will help you do your diet planning for your family. All right. As far as play for this preschool child is going to be what we call associative play. They enjoy imagination and dramatic play. They like to play together. They like to imitate same-sex roles in play, like they want to play the mother, or they want to play the father part. This is a good age to provide toys to develop their coordination skills, such as a tricycle, clay, painting things, puzzles, books. We need to use parental supervision as far as when the child is watching television. And at this stage, they also enjoy sing-along songs, once again. So the play for a preschooler is known as associative play. Okay? Now, when you are caring for a child who is a preschooler, you always want to be cautious of the words that you utilize. Okay? Let's say we have to give the child an injection, and we tell them, we're going to put a stick in your arm. Well, they're literally going to think you're going to put a stick in their arm. So they may become very fearful. So you may want to tell them that you're going to give them an injection and that it may cause a little discomfort. Just be very careful of the words that you utilize, because if you tell someone it's going to hurt or you tell someone it's going to be painful, that's what they're going to imagine, and then it will be to them. Okay? All right. As far as health promotion, it's very important that they get their physicals, and this needs to include vision and hearing screening. Because for young men at this age, if they're going to have any problems with color blindness, or with boys and girls, if they're going to have any vision problems, which is going to cause them to have problems reading, this is when we want to identify it. So they need annual physical examinations, which include vision and hearing screening. We also want to make sure that we keep their immunizations up to date. They should have had, at this time, their DTaP, which is their diphtheria, tetanus, and pertussis. They should have had their MMR series and their varicella at this time. All right. We also want to be cautious and watch. You don't see this as common as you used to, but years ago, this age was very, there was a high percentage of children being treated in hospitals for lead poisoning, because they would peel the paint off of the window ledges or off of the stair banisters, and they, of course, would put everything into their mouth. So we would see a lot of lead poisoning. Now, most paint that is made, unless you live in a very old house, contains no lead. So we don't see this as common as we used to. But lead poisoning can lead to brain damage, and it can also lead to learning disabilities. Years ago, we screened children in the elementary schools for lead poisoning. All right, let's look at safety. At this age, the child is going to have, they're going to be less prone to falls, once again, because they have strengthened and increased their gross motor skills. All right. All these children should be in a safety or booster seat until the age of 8. We always want to teach them to use their seat belt when they're riding in a car. Okay. We want to teach them safety habits. If they are riding their bike, they need to use a bike helmet and pads. They need to be taught that if they're crossing the street, that they need to watch both sides of the street before crossing, or to look both sides in both directions before crossing the street. And they also need to be taught not to run into the street. Let's say they're playing ball and the ball runs into the street. They need to be taught that they need to not run into the street after the balls, that they need to look both directions before going into the street. Okay? We want to teach them injury prevention in regards to traffic, in regards to speaking to strangers, taking candy from strangers. We want to do fire and water safety. That's very important. All right, let's look at the preschoolers' reaction to illness and hospitalization. They are going to have some major fears because, as I said, they have the cognitive ability to understand that this is out of their routine. They're going to be meeting a lot of different people. They're also going to be experiencing some things that they have never done before. So there are some major fears. And one of them is mutilation. They don't understand the concepts of medication administration. They don't understand the concept of surgery. So they're going to fear that something's going to happen to their body. All right? So they have that fear of mutilation. They have a fear of intrusive procedures because they misinterpret words. Remember, they've got a very active imagination. So you want to speak clearly, and sometimes you may even want to use a pad and show them with pictures. Okay? All right. Let's look at, remember, they may still have some fear of separation. Because their parents may be taking turns coming and going, and if both parents have to work, then they may be there at the hospital by themselves. Hopefully not for the whole day, but perhaps for an hour or two that there might not be anyone with them at a certain time of the day. So they are going to have some separation anxiety. Okay, let's look at the preschooler's reaction to death and dying. The preschooler's reaction to death and dying. At this age, between the ages of 3 and 6, the child is going to view death as a temporary and reversible thing. So they don't have the true understanding. All right? They view death as a temporary and reversible thing. They have a lot of magical thinking. They're very dramatic. They may also view death as a punishment, meaning if they have bad thoughts or if they do bad things, that this may lead to death. Okay? At this age, the children may experience have their first exposure to death in the incident in case there's the death of a parent or there's a death of a pet. Okay? So their first exposure to death is frequently the death of a pet or perhaps the death of a grandparent. Common behaviors that are seen. There might be some regression in their behavior. They may have nightmares. They may have bowel and bladder problems, so you may see some bedwetting. There might be some anger and out of control behaviors. This is all due to their reaction to death and dying. Okay, we're going to stop here and with the school-age child tomorrow.